Hello everyone, welcome back to my channel and welcome to my new video. This video is about assessment station. What we do in assessment station from starting to till end. So in this video I'm going to tell you everything about the assessment station from introduction to till end, what we have to do in this station. So if you are preparing for the OSCE and want to learn about the assessment station, watch this video till end to get all the information about the assessment. And please, if you have not subscribed my channel yet, please subscribe it right now to get all the information about OET, CBT and OSCE, and like and share also. So let's start with our video. So as you know, assessment is of 20 minutes. They will give us 20 minutes to complete assessment station. So assessor will give you the patient history form. Everything would be written on that form. Patient's name, his history, about the presenting complaints, about the diagnosis, what drugs he is taking. Everything would be written on that form, and you have to read that form within the 20 minutes. They will not give you extra time for reading that, and they will start the timer when they will give you that form. So when you will take that form, you have read that form of patient's history. You have to read it carefully because you should know what the diagnosis is. You should know everything about the patient, so you have to read that carefully. So after reading that, you will check the scene safety. Check the scene safety if the scene is safe for you to approach. Like you can verbalize, I will enter the room, I'm checking the scene safety, the scene is safe for me to approach. Then you will check the privacy. You will close the door and draw the curtains, or you have to maintain the privacy and dignity of the patient. Then after checking these things, you have to do the hand hygiene before approaching the patient. Before approaching the patient, you have to do 7 steps of hand hygiene according to WHO guidelines. You have to do the hand hygiene and you have to verbalize each and every step of the hand hygiene. Like I'm taking the alcohol rub, palm to palm, right palm over left dorsum, vice versa, fingers interlaced, fingers interlocked, rotation, vice versa, rotation of tip of finger, vice versa, rotation of thumb, vice versa, rotation of wrist, vice versa, and I will allow my hands to dry for 30 seconds. This is how you have to do your hand hygiene, and you have to verbalize each and every step. This is how you have to do your hand hygiene. After the hand hygiene, you will go to your patient. You will greet your patient and introduce yourself, like hi John, I'm Navjot, one of the registered nurses here. So you will tell him who are you, and then after you will check his ID and allergy. You will ask patient's name, like what is your name, what is your date of birth, name and date of birth you will ask. Then you will reconfirm it with his wristband, ID band. There would be a band on his ID. You have to reconfirm it from his ID band. You have to check allergy, if he is having an allergy, and you have to reconfirm it from his allergy band. You have to do it, both things. Then you will ask him about if he is having any pain. This is in the criteria. You have to ask about the pain, if he is having any pain, and if he says no, that's okay. And if the patient is saying yes, I'm having pain, then you will ask him to rate his pain on the pain scale. You can verbalize like, okay John, can you rate your pain on the pain scale for which 0 is for no pain and 10 is for worst pain. Then he will tell you the score, and according to that you can tell him it is mild, moderate or severe pain. And then you can tell him that after the assessment I will check the prescription, and if there would be any medicine prescribed by your doctor, I will give that to you, and if not, I will escalate this report to the doctor so that he can prescribe you the medicine or suitable analgesic. This is how you have to verbalize. And you have to ask him that can he tolerate this pain for just 15 to 20 minutes. And if he is saying yes, then you have to continue. Then after you have to after checking the pain and that's all, you have to tell the purpose of the visit, why you coming here. Then you have to tell the patient that I'm here to do your A to E assessment, which include airway, circulation, breathing, disability and exposure. So it will take about 15 to 20 minutes. So is it the best time to proceed? Then he will tell you yes. Obviously he will tell you yes. you have to take the consent that is it the right time to do your assessment. Then after, you will tell the patient that now I'm going to take the articles. Are you comfortable? You have to confirm 3C. What are the 3C? Comfort. You have to ask, are you comfortable in this position? Yes, he will say yes. Then, do you have any concern? You have to ask the concern. Okay, he's saying yes. No, I don't have any concern. Okay, then you have to tell him that if you need anything or you want to ask me anything, just press the call bell. I will come back to you to help you. You will tell him that if you need anything, he can press the call bell. Then you will come and help him. So after this, you will leave the patient and do the hand hygiene, and then you will have to make sure that all the articles are clean and calibrated within the 24 hours. What articles you need in the assessment, you will take and make sure that these are clean and calibrated within 24 hours. What you gonna take? BP machine, temperature thermometer for checking the temperature, pulse oximeter you will take, and fob watch for checking the respiration and pulse. So these are the things you're gonna take with you. And then after taking this, you have to do the hand hygiene. Before approaching the patient, you have to do the hand hygiene. In first hand hygiene, you have to verbalize each and every step and do it. Then after other hand hygienes in this station, you can just do it quickly. No need to verbalize all the steps. So after doing the hand hygiene, quick hand hygiene, you will go back to your patient, ask about the comfortable. Is he comfortable? He will say yes. Then take the consent, like, can I start your assessment? He will say yes, you can. Then you will start your A to E assessment. In A to E assessment, you will start from the airway. You can do in any order either, but it is good to start from the airway. And in A to E assessment, what things you're gonna assess, I will make a separate video on this, because if I'm gonna tell you in this video, it will be very long and boring for you. So I will make a separate video what you have to assess in A to E assessment. So you have to do A to E assessment, like you have to check all the things: temperature, pulse, respiration, so oxygen saturation level, capillary refill, airway of the patient, and each and everything you have to take in his about the disability. If he's having in pain, again you have to check about the urinary output, if he's having any bleeding, rashes, or anything injury on his body. Everything, each and everything you have to ask. Then after doing the A to E assessment, while checking that all the readings, you can roughly, they will give you a paper for writing the readings roughly. You can roughly write each and everything, so that after that you can do the documentation properly. You cannot do the documentation on the proper chart simultaneously. No, you have to roughly write the readings, and after that you will do the documentation on news to or GCS chart. Then after doing that, you will tell the patient, okay, I will come back to you within few minutes. I'm going to do the documentation. You will do your hand hygiene, quick hand hygiene, and you will do the documentation properly. Everything, time, date, everything should be very correct, because if there would be a minor mistake in the documentation, they will fail you, and you have to resit in your assessment station, full assessment. So after doing the documentation, you again do hand hygiene, quick hand hygiene, come back to the patient and tell the results that you have got this score, and if there is a need of escalation, you will tell him, I will escalate to you, to the medical team. And if there is another chart you have, like PHQ-9, 6 EIT or must AR, you have to explain that as well. And after explaining the chart, you will do his holistic assessment. Like you can start like, okay John, I need to ask you some more question, can I proceed with that? Okay, he will say yes. Then you have to ask about the question about the holistic assessment. What include in holistic assessment? You have to ask questions about physical, psychosocial, psychological, spiritual, and sexual requirements of the patient. In physical, like you can ask a question about his physical mobility. Do you need any assistance in mobility? If he's saying yes or no, according to that, you can give the answer. Then you can ask about his nutrition. Is he taking the food regularly? If he is having any diarrhea or constipation, how is his bowel movements? All the things you can ask about in the physical. Then in the psychosocial, you can ask his sleeping pattern, or about his family members. Everything you can ask. And in spiritual, you can ask only one question in this, like, is he need any special requirement in meeting his spiritual needs? Or in sexual, you can ask him, do you have any gender preference while taking the treatment? He will answer you yes or no. And this is all. After the holistic assessment, you have to conclude your station with the conclusion statement. Like, you can conclude like, assessor, I have done the procedure and have done the A to E assessment of my patient. I have done the documentation according to NMC guidelines and discard all the used items according to NMC guidelines or hospital policy. My patient is comfortable, thank you. This is how you can conclude your station. And this is the assessment station. These all things you have to do within 20 minutes. They will not give you even a 1 second extra. They will not give you. You have to do within 20 minutes, and you have to be very quick. It's not like the patient, the actor will be very cooperative with you. No, he can ask you extra questions in the assessment. He can ask you like, I want to meet my sister, I want to meet my spouse, I want to meet my cat. These things he can ask, and you have to answer those questions as well. And you have to manage your time, and you have to do all the things. You can't miss even a single thing. You can't ignore the patient's questions. You have to answer all the things, and you have to manage your time also. So this all you can achieve only with the practice. Practice is must. So you have to practicing verbalize all the things, and definitely you will pass your assessment station in the first attempt. So this is about the assessment. To know about A to E assessment, what you have to do in A to E, in airway, circulation, breathing, disability exposure, watch my next video. And thank you so much for watching this video. Please subscribe my YouTube channel to keep updated and get information about OET, CBT, OSCE and the NMC registration. So thank you. Bye bye.